again, RT listeners, and welcome to RT Matters, the place where we have candid conversations about what matters most to respiratory therapists. I'm your host, Patrick Dunn, and I'm delighted to have a guest with us today who really has distinguished exactly what respiratory therapy advancement is all about. I'm pleased to introduce you to Dr. Brian Walsh. Dr. Walsh is the professor in the Department of Respiratory Therapy at the School of Health Professions at the University of Texas Medical Branch in Galveston, Texas. Brian is also a registered respiratory therapist, long-term respiratory therapist. He has also the specialty credential in adult critical care and neonatal pediatric. He's also a registered pulmonary function technologist, and he was awarded fellowship in the AARC. I should also point out and disclose that Brian served as the AARC president from 2016 to 2018, and as a virtue of that, he is a member of the President's Council, which we serve on together, to give information to the current board of directors what we think we should do in terms of certain questions that come up, and we just give them their advice. Brian, welcome to RT Matters.
Thanks for having me.
Oh, we're delighted. Now, look, one of the features of RT Matters, we want all of our invited guests to kind of just take a brief moment and explain, did respiratory therapy find you or did you find respiratory therapy? So where were you when you personally decided to become a respiratory therapist?
Well, I was in a unique situation. I was finishing up my last year of high school at the community college. They had a program there where I could take advanced courses and get college credit for it, and also satisfy some of my health or high school requirements. And so I had to take U.S. government, things like that. And so I knew I wanted to be in healthcare. I didn't know exactly what aspects of healthcare. I really thought I was going to be a paramedic firefighter. And because I enjoyed that hobby and job with my father, who was a volunteer firefighter and rescue squad member. And so we used to do that stuff together. And I actually used to take patients into the emergency room, just like most paramedics and firefighters do, and things like that. And I met this respiratory therapist by the name of Charles. Charles worked the evening shift, and Charles was a guy that I actually used as a memory peg for some of the gas laws that we know about, like Charles's law, because Charles.
It's funny you mention that because Ed Coombs, who you probably know works for Draeger,
Yep.
He also was a EMT paramedic. Yep. And he also recognized respiratory therapists when he delivered one of his crash victims to the emergency department. And he was impressed with how well the respiratory therapists took the handoff from the EMTs and the paramedics.
Yeah, and so that was the same in this situation, and Charles was the go-to guy, if you will, in the emergency room, particularly on that evening shift, and that was back in the day when we worked 8-hour shifts, and so he was pretty much 5 days a week, and so I asked him often, and he was kind of I call him the man, you know.
That's right. That's why I'm saying to all of our colleagues, remember, never know who's watching you and how you might influence their career. Well, you actually continued on. You continued your certificate of completion in respiratory in 1995, then your AA degree in 96, and your bachelor's degree in 1999. But you didn't stop there. You went on to earn both your master's degree and in 2016, your doctorate degree. First of all, congratulations for all those steps. So looking back, what prompted you to continue your education once you obtained your RRT credential?
I had good mentors. I came, all the way from my respiratory therapy teachers. And so I was in a certificate program, which no longer exists for therapy, but
me too.
And the professors there knew that the profession was advancing. And so they encouraged me, go get your associate's degree so you can become RRT eligible, and sit for the RRT exam. And so, based on their prompting and pushing and even kind of giving me an application for the associate's degree program, I went on and continued on.
Little arm twisting there, right?
Yeah, a little arm twisting, a little pushing. pushing and shoving and things like that. And because I was not like a high performer in even my certificate program. And so I was very much a visual and audio learner. And so hands-on, I could really do some great things and never struggled in labs and clinicals. In the didactic courses, though, I did struggle a little bit. And so I was surprised that they advanced me on.
Yeah. Well, we all learn to teach ourselves after a while. Early in your career, aside from continuing your education and holding down a full-time job, and I'm also assuming some family, you also volunteered your time in several of the affiliates, for example, in Virginia at the time when you're going through your training, and more recently when you moved to Texas. And you also served as the AARC president. And you continue to do that today. In fact, you're now the senior delegate for the TSRC to the AARC House of Delegates.
I am. Yeah.
How has this time that you spend volunteering helped you in your professional growth and development?
Yeah, so I was always encouraged, again, by good mentors. Pat Dorley, who we both know and love, she was an avid volunteer in the profession and really saw the benefits of networking and things like that professionally. And so she encouraged me and then would also even invite me as her plus one, at times to receptions and things like that, just to help get my foot in the door, because she knew that, once I got in there, I could make my own way and things like that. And so I enjoyed that. And because others volunteered on my behalf, and benefit to mentor me, I've always felt the sense of gratitude, but also wanting to give back.
Yeah, it's time to give back. Well, you had a stellar career, and it's a combination of a lot of your initiative and having mentors and also making the right choice. Now, onto the focus of this episode, and the reason that we really are inviting you today. Advancing your career through degree advancement. And we see a lot of online discussions by RTs about their career options. In fact, we had prior episodes with Ed Coombs, who we just mentioned, about respiratory therapy as not a dead-end career, and more recently with Kevin McQueen talking about peripheral roles for respiratory therapists in the hospital. So some of these therapists are saying, I wonder if I made the right choice in respiratory care. And some of them are even talking about hanging it up and walking away. What kind of advice would you give to these individuals?
It's always a tough question, right? And so it's one of those things where, I often talk to degree-seeking students who are also respiratory therapists and want to advance their practice. And the first question is do you want to use this degree to advance your career within respiratory therapy, or do you want to get out? And if you want to get out, then I'm not sure an advanced degree is actually for you. But I'd encourage them that there are many benefits to staying in the profession and review with them, because sometimes you only see what's in front of you. And I have the ability to move around this wonderful country and offer job promotions and things like that. But I got to see the profession from a different lens in almost every community that I went into, because we do it differently. And so there are options. There are many options.
Yeah, I think one of the things that Ed pointed out is that, you want to have these people consider how much effort they've already invested in getting their RRT. And most of them graduate from associate degree programs. That's still the dominant entry, although that is changing across the country. So you have the AA degree. How about getting on to their baccalaureate degree? What options are available for a degree advancement to get their baccalaureate degree?
Yeah, I mean, the baccalaureate degree, there's many options now. And so many of them have actually gone online and can be accessed from anywhere in the country.
Yeah, I actually talked to the cohort people, and there are now 34 degree advancement baccalaureate programs for RRTs, and they're all online. Yeah. So you're absolutely right.
And that's just the ones that are COARC accredited. There's actually more that are not COARC accredited and things like that will still help you advance your degree to the bachelor's level.
If you have your RRT, that's really kind of an option that's open to people with RRT. Right. It doesn't have to be a BS degree in respiratory. That's a good point. Good point. All right, now let's take a look at those who really like clinical work. They're happy in the hospital, and they want to work in the acute hospital, and they have their RRT credential. why would they consider a specialty credential like you did back in your early days of your career?
Yeah, so I think the specialty credentials are a nice way to improve your practice and improve competence of your practice within specialty arenas. I first started off with the NPS because that was the area that I was in, neonatal pediatric specialty, and I wanted to challenge myself to a higher level of competency. As a director, I then became to require it at children's hospitals that I worked and things like that, because I saw it as the new basement level, if you will.
So a lot of institutions make that part of the job requirement than the advanced credential. And the same thing probably with adult critical care.
Yes. Yeah. And same thing or to at least climb the clinical ladder or become a clinical specialist. Having a specialty credential is really important to, again, demonstrate that level of competence that has been taken and achieved.
Yeah, these specialty credentials are offered by the NBRC, and actually all you really need is the RRT credential to apply for these with a certain amount of experience. So even with the AA degree, you can actually distinguish yourself a little bit different from your colleagues.
Absolutely.
Okay. Now, what about the other one, this Advanced Practice Respiratory Therapist? This is something that's new on the horizon. And I should point out that the AARC and the NBRC and COARC all pursued this at the direction of our colleagues in the physician community because of the looming shortage of qualified physicians in pulmonary medicine and critical care. We only have one program, Ohio State University. Have you had any discussions in Texas about offering such a program?
Yeah, we're actively pursuing that kind of as we speak. I've been heading up a APRT task force, and we've already petitioned to the Texas Medical Board for an understanding of the pathway that we would need to take to achieve this advanced role. This advanced role, as you know, and maybe some of our viewers would know, but maybe not, is that it's more of like a PA role for a respiratory therapist or a nurse practitioner. And so that mid-level advanced practice provider is kind of the category that we would be going for.
And they would be basically working alongside physicians and at the same time, just like you said, the nurse practitioner or the physician's assistants. Well, anyway, right now there's only one program, and several of those graduates are doing very well, primarily in the VA system. And boy, that's the largest employer in the United States of healthcare workers. And if the VA likes it, it seems to me it's going to probably get some things. Now,
there's a second program that just got their letter of intent approved at the University of North Carolina, Charlotte, and so I'm looking forward to them enrolling their first cohort as they get through the process of MARC accreditation.
Well, it's just like when the PA started out. It just takes one, then all of a sudden people realize what a great contribution it is. Now, what about those who like acute care, but they also recognize there's an awful lot of opportunities in chronic care, primarily in asthma and COPD? Where can they go? What types of credentials can they receive?
So there's sort of the pulmonary rehab kind of credentials and disease management and things like that they can do. Asthma educator credential by the NBRC, and so there's some additional competencies that they can declare as well or go for. But it's a huge opportunity, and this is kind of, my eyes have been open to, outside the four walls of hospitals that I've largely worked in or universities. And it's a growing population. We're talking about, and we learned about in COVID, the hospital at home with advanced monitoring and telemedicine. We've done a lot of things through the pandemic that we never thought were possible.
Oh, that's right. I have several hospital administrators tell me that COVID, and not being unkind, that COVID was one of the best change agents ever, because it really showed that healthcare systems can indeed turn on a pivot if they have to. I saw.
I always say never waste a disaster.
That's right. That's right. Never waste a disaster. And also the NBRC offers a sleep disorder specialty for people looking for sleep medicine. And that's another area with a huge population of patients that have yet to be diagnosed and treated. And we now recognize a lot of the side effects of undetected and untreated sleep apnea are all related to cardiovascular deterioration later in life. So that's another opportunity. And I should also point out, like you point out, the pulmonary rehab certification, the AARC has a program online for that. It's also done in partnership with the American Association of Cardiovascular and Pulmonary Rehab. So there's a lot of opportunities for the RRT to go on and specialize themselves. Now let's take a look at these programs that you offer and our main reason for contacting you, aside from the fact that you're also a good friend. But that's the program that you have. You have two programs. You have the MSRT entry level, which is a master's degree entry level. And the unique thing to me is geared primarily to individuals who graduate from an undergraduate program in life science or some other degree, but it's not respiratory. Maybe they wanted to go into medicine. They realized that they now can't do 4 or 5, 6 years of medical school or vet school. Now they come to you. What's the nice opportunity that you're giving these kids, these graduates, I should say?
So, one of the things that I've been a big advocate for and I pressed a lot during my presidency at the AARC was advancing our entry to practice. I'm a firm believer that with additional education becomes patient safety and quality are associated with that. That's why our nursing colleagues have really pushed for the bachelor's entry to practice. Our physicians, are at that 4-year program plus residency. And so if you see individuals having educations that are less than 4 years for their MD, for example, or their doctorate degree, you'll see that they have to go through a residency that is equivalent to a U.S. residency, if not in the U.S., outside the U.S. And that's all based on basically our understanding and the literature about the more education, the higher level of competency, and the more safe and effective care that you can provide. And that's what I see in respiratory therapy. Long gone are the days that, Patrick, when you and I used to practice at the bedside, it's like, I would love to have those simple patients nowadays. Nowadays, patients are so complex and they have so many different confounding factors and diseases that really can cloud and complicate their course. And so it's something that I see that our population is getting more and more complex, which then therefore needs, to me, a higher level of education. Our program values the undergraduate bachelor's degree, and because it gives you a lot.
Let's just point out these are people who are not respiratory therapists. Maybe their degree is in biology or chemistry. Maybe they were pre-med, but they got their baccalaureate degree, but now they look at respiratory as another career option. So that's why it's a master's level entry level.
Yes. Yeah. So we take someone that have to have a bachelor's degree. They can have a bachelor's degree in anything as long as they have the prerequisites. So most prerequisites align up with a bachelor's in science more easily. But we have in the past have bachelor's of arts. They took a lot of the prerequisites that we needed. And so, they get a chance. We have very few that actually, they wanted to go into a master's entry to practice program from their undergraduate because we really haven't existed. We're one of 7 programs currently that are COARC accredited for entry to practice. And so we're kind of on that cutting edge of push to advanced practice.
You offer those disillusioned baccalaureate graduates who now realize that they're not going to go to medical school or dental school or veterinary school. You offer them a career in a very exciting profession. And I think they're probably very well motivated to recognize that this is a great opportunity. And they come into it with a baccalaureate degree already.
Correct. Yes. And so some of them, get like a bachelor's in biology and they want to go out there and be a biologist, but in those jobs are few and far between without having to get a doctorate degree in those areas. And then the pay is not anywhere near where a respiratory therapist would get paid for those types of positions. And so they also see the future in that as well, as that I typically will always have a job. There's lots of vacancies for a good respiratory therapist. because they've not thrown away their hard work that they achieved for their bachelor's degree, they're actually adding to it. And so instead of stepping down to an associate's degree program, become a respiratory therapist, we're now giving them an option to elevate their education and become a respiratory therapist.
You know, it's a very innovative program. One of the reasons we wanted you on the program today is because it really does offer these folks a great opportunity. And they're already disciplined. They've gone through 4 or 5 years of college. They've got all the requirements out of the way. And now they come into your entry-level program. And some people say, well, gee whiz, a master's entry level, but they don't understand they're coming in with a baccalaureate degrry. And I think it's a wonderful, wonderful program. And I know a lot of thought went into it, and I'm really happy you did it. Now, the other program that you had, which, by the way, this was only for obvious reasons going to be in person, on campus only for the back, because they don't really have any experience in the field. So they have to be online, on campus, I should say. Now, the other program you have is for RRTs who have a baccalaureate degree in any field. They went on to get their baccalaureate degree. It may have been a BSRT, or like you said earlier, there were other programs out there that don't necessarily prepare you for the RRT, but give you credit for your associate degree. Now, these folks want to go on and get a master's degree. And now you have what we have, the MSRT degree advancement option. And I'd like you to just tell us a little bit about how that came to fruition.
Yeah, so this one was designed after my looking over the human resource survey that the ARC does, and seeing the number of leaders that are going to be retiring in the next 5 to 10 years was just super high. And I'm like, we've got to get out of this kind of on the job training, because as you know, Patrick, we've kind of come through this as like, oh, you're a good clinician, so that means you'll be a good educator, or you'll be a good.
I think, Brian, I think they used to call it the Peter Principle. Eventually, you'll get to your level of incompetence with that thought up.
Right. And that's what we do. We repress people until they almost fail. And, on the job education or experience can be a wonderful educator, but it also depends on your level of mentorship along that way, because you can also practice the exact same way that you came out of respiratory school too, even after 10, 15, 20 years of experience. And if you don't choose to educate yourself and continue to self-learn and things like that. And so I wanted to create a formal education system for our next leaders. These are guys that are already out there practicing, but they know that they want to climb that ladder, whether it's a clinical ladder or management. And so we kind of broke it into 3 tracks.
Right. We'll talk about each track, but I think you're right on, because the hospitals, the other institutions that will hire these people are looking for that advanced training, because they expect that in their nursing program. They expect that in their x-ray program. They expect that. Let's take a look at the first one. There's 3. There's a leadership, there's the education, and then there's the research. Let's talk about the leadership track first. What positions will these graduates aspire to with their master's degree in a leadership track?
Yeah. So every, because I'm giving you a master's in respiratory therapy, we have to have a core group of respiratory therapy classes. And so these are advanced classes, advanced disease management, advanced mechanical ventilation, additional like neonatal pediatrics, ethics, and things like that. And so that's part of the core that everybody gets, because I can't give you a master's in respiratory therapy and not have respiratory therapy.
Sure.
There.
Absolutely.
And then our leadership track is actually multiple opportunities to advance your leadership skills, whether that's finance, healthcare finance, things like that, to management strategies, human resource management, and things like that. Typically, what you would see in like an MBA or an MHA course.
Sure.
And so it's specific to our profession a lot of times, and so allows us to then add that additional education. One of the things that these are graduate students, and so many of them like to pick and choose. And so we wanted to give them options in which they can kind of cater their own education or curriculum to their educational goals.
Right. Well, see, these leadership positions, it seems to me you're preparing the graduates if they get into a director or department director or a clinical supervisor or some type of management, they're now more capable of interacting with their peers in the hospital administration in terms terms of the chief financial officer, the human resource officer. They have the skill set to be able to be an extension of those particular, whereas in the past, you went down to the human resources because you think you're in trouble or something.
Right,
you know?
right. Yes, that's exactly right. And so that supervisor job, that, shift lead, and to all the way to assistant director, director, manager, that's the type of jobs that this, I call it operational leadership track, will provide you, meaning operations, particularly of respiratory therapy.
Well, we're seeing our colleagues in industry, manufacturers of medical devices, distributors, and even pharmaceutical companies, when they look to hire respiratory therapists to help promote their respiratory product line, they're looking for people that have that exact same skill you were talking about.
Yeah, in fact, we get a lot of inquiries from our industry partners who want to advance in that area, and the same kind of rule applies to them. If they want to kind of climb, from sales or education to leadership positions within industry, then the operational track is perfect for them, particularly if they sell a large, respiratory product line. But if you want to be a industry educator, then that would be our next
that
we'll talk about.
Which we'll talk about that. And again, a lot of the industry activities is that, like you said earlier, if you're a respiratory therapist, you must be good at sales. And that's not the case at all. You must be good at time management. Not the case at all. You don't have to learn that. And that's no on the job. Well, let's take a look at that second track you mentioned, which is the education leadership track, which is where you are. You're obviously very favorable to this for obvious reasons because of your position. But what about the respiratory therapist who takes this track? What type of opportunities are we looking at down the stream for their particular profession?
Yeah, so this is one that is probably our most popular track. And so it's many individuals who want to get into respiratory therapy education and things like that. One of the things that our accreditors look for in a respiratory therapy educator is actually graduate studies in respiratory therapy. And it makes sense, right? You want to be taught by someone who has had graduate education or even maybe a master's degree in that subject, because it makes a lot of sense. And so this track allows you to get that, and it exceeds kind of the typical requirements of 16 to 18 credit hours in the subject that you're teaching at the graduate level. And so this gives those students or graduates a leg up on those who would have to have an exemption. And so many of my colleagues have to have an exception for that. In other words, I have to say, all right, Patrick Gunn, I want to hire you as an educator, and you have 400 years of experience and and you have a master's degree in health administration or whatever it may be. And I have to write a justification that I'm signing off on your credential.
Right.
And I think while that's acceptable, the more and more master's degree programs, the more graduate education that we have in respiratory therapy, I don't think those exceptions are actually going to work in the future, because you need to be formally trained in the subject that you're teaching.
The other part of it is not just the content, but as you pointed out earlier, you have to be able to know what a good test is. Is it a reliable test question? Does it measure the job performance? Because all this is legally tied to the credentialing system. And how do you measure and assess a student's performance? And, we used to write questions, but now today it's a whole different world with psychometrics, as you pointed out.
Yes. Yeah. And just even technology that we're using today, we educate you in classroom technology and things like that you should be able to navigate well to be an effective educator in the future.
Now, in the academic setting, the college or the university, understand, what about options in the hospital itself for someone who goes through this education program and gets all of these nice skills?
Yeah, so that's another opportunity is for those guys to be able to advance their skills in adult learning principles and things like that you're not taught in respiratory school typically. And so we give you, again, the core respiratory content and knowledge competency, but then we also advance that competency with educational techniques and things like that allow you to have the best outcomes.
Yeah, the big term now is onboarding when you have a new hire coming into a department, and there's so much to impart. So a lot of departments are hiring clinical educators, and of course they would want to have that experience base as well as the graduate training for adult learning. They're teaching their peers, but at the same time, great responsibility in terms of the liability exposure.
In a lot of larger institutions that have, a lot of onboarding, they've actually created kind of internships and things like that. And they're actually teaching didactic classes and things like that to help bring up those new respiratory therapists to the level of the entire staff. And sometimes that takes a lot of work to be able to do and coordinate and things like that. And then also, when we make mistakes, so quality metrics and things like that, it's like being able to identify that, hey, there's an educational gap here that's leading to poor quality, and me as a researcher or as a educator, needs to come in and actually bring that educational level up so that they will actually then be able to improve the quality and performance of the respiratory therapist as well as efficiency as well.
Yeah, I can see that these individuals will be a great liaison from the department to the patient safety committee and to the QI department. In other words, being able to speak the same language, respiratory therapist content, but at the same time, the hospital-wide initiatives to improve safety, to improve efficiency, and all of those other aspects. Well, now we're going to...
It also allows them to be better colleagues because, our nursing leaders and educators, they actually have formal nursing education and that they go through to get their master's degree.
Sure.
And so now we're playing on the same ball field.
Yeah, I think the expectation is really there, and you're really meaning that. And like you say, you're using the human resource data that is real-time data that basically shows this is what we are looking for. And you're right about the absence of qualified people taking those positions. Yeah. We're also seeing medical device companies. You mentioned it earlier, but I just want to reemphasize medical device companies with this new technology require someone who can go in and teach their peers in a hospital how to use this new device, and the changes in technology are there. Are you seeing some of your graduates going into that role as an educator working with industry?
Yeah, some of our entry to practice as well as our degree advancement students going straight into industry. And I felt like I only saw that in pharmacy and in medical school, but I'm seeing it also in our profession, which is exciting because it's, again, another pathway that people choose to take and they really enjoy it. And they're contributing positively to the practice of respiratory therapy, just in a different way.
Yeah, and some people say years ago, back in the day, if you went into industry, you couldn't cut it in the clinical side. Right. And now today, people say, I can have more of an impact teaching 500 therapists in 15 facilities how to use this product. So I'm improving patient care on a larger scale. So it really does bode well for what you said. Yeah. Well, now I want to talk to you a little bit about something I'm sure is a little bit closer to your heart, the third track, which is research. Yes. And I wanted to point out that since 2002, you have either authored or co-authored over 61 manuscripts published in peer-reviewed journals. So obviously this is something that's personal for you. And I really like to drill down because one of the things that the late Bob Kazmarek said for years and years and years, along with his colleague Dean Hess and Rich Brentz, we need more researchers, our own researchers, to do the work that needs to be done. Right. What made you go down this road and offer this research track?
Yeah, well, like you mentioned, it was my passion, and it's something that even as an avid kind of clinician as well as educator in the past, it's like 80% of what we do hasn't been proven to be helpful or effective a lot of times. And it's kind of frustrating. And I joke with my student, but I want to lower that to 79% by the time I retire. Like that's how big of a job it is. And that when we're going to more evidence-based practices and things like that, we have to have the evidence. And no better way to develop that evidence is through respiratory therapists. And so, and I saw that there was, again, kind of looking at the human resource results, as well as just kind of around other master's degree programs and things like that. And I'm not seeing anybody kind of advocate or create a track for research. And so one of the reasons that I came to UTMB is because at the master's level, we do have to create opportunities to do research for our students. And so I was blessed with coming here, and they allow me to create a lab and things like that, which traditionally I would often be working under a physician, but here I have my own lab, and I run it, and I'm allowed to do independent research and things like that.
So you're also preparing students that come into this program, giving them the skills that they want to go on and get their doctorate and actually really go to the top of the food chain, as it were.
Yes. And so we have, capstone opportunities for those who want to more clinically practice. And
Capstone, explain capstone for our listeners, if you would.
So capstone is just kind of one of the, like the term means capstone is kind of like basically demonstrating all the competencies that you've learned through your educational process here at UTMB through a project. And so it has a little bit less rigor than a thesis, for example. And so our research track has a thesis option, and it's triple the credits. And so it's a bigger deal, but it allows students to really take on research meaningful way and actually conduct even down to a clinical trial if they so desire, and we can get funding for it and things kind of the stars align, if you will. And so, but that's what we put the research folks through the research track. So there's some research like statistics and research methods and things like that we teach the students. But largely, it's a thesis track, meaning I'm mentoring and several other PhD prepared faculty mentor people through research projects, and so that they do it in an efficient and safe way, and get them the experience that they need for that. And so it allows them to prepare to take on research tracks. And so going to their PhD, then having a thesis is a little bit better for them than, say, a capstone when it comes to resume, if you will. It also will likely ensure that they get some publications out of it and things like that, because that's one of the goals is to publish, whether it's an abstract or a full manuscript.
You mentioned earlier the fact that the profession, healthcare in general, is moving toward this evidence base, and obviously the manufacturers and the developers of new products and new medications, new molecules are conducting research, and they have to have individuals who liaison with the clinical site. So you're also preparing a new cadre of research oversight for the pharmaceutical side, for the outside, the industry, as we use that term generically. I should point out, coincidentally, you pointed out something. We had Bob Joyner, who's director of research at Tidal Health out in Maryland, and he's also an RRT. He's director of a research institute. And I asked him during our episode, why don't more therapists want to go into research? And he said, Patrick, it's like a black box. It just intimidates them. They're scared to death of it. They say, I don't know anything about numbers or statistics. You're addressing exactly what he said the main obstacles were.
Yeah. And it is. And it's still to this day, I take every student is like, oh, I got to take statistics, they're complaining about it and things like that. And then it's fun when they actually get into it. They're like, I can do this.
That's what he said. It's like once you get in there, you can't stop them.
Yeah, and it's so fun to see that light switch, trip on and go from there.
Well, Brian, you've certainly provided our listeners with incredible options, both within the RRT domain, but also the baccalaureate degree and then your graduate programs at UTMB. I like to ask you one final question. Any final thoughts, words of wisdoms to our listeners, especially for those who are still wondering if this profession can indeed be a lifelong career?
Yeah, I think education, and I'll just take that perspective, can be your ticket to a better, more fulfilling career. And so a lot of times you'll notice that there's kind of this glass ceiling. And a lot of times they want you to have that educational level to be able to climb to that next level. So it doesn't mean you can't do it with on-the-job experience and really going after it. But education really helps along the way. And there's so many more options than when I first started in the profession.
Oh, absolutely.
To be able to pick and choose, and so if it's not our program, then there's maybe other programs that are just as good for you, if not better, matches for you. And I think you should pursue those, explore that. Never stop learning. One of the things that, I learned when I was in Boston is that I love to share is that at Boston General Hospital, they a lot of the attendings wear short white jackets. And I asked Bob Kazmarek, I was like, well, how do they do that? And he says, it's because they want to show that they're always medical students. And so I feel like as respiratory therapists, we should always be respiratory students.
Absolutely. Always ready to learn. Look, I'm going to go ahead and give your website for listeners who might be interested. Is School of Health Professions. So it's shp.utmb.edu. And that takes you right to your program with both of the options that we decided. I'll say that again, shp.utmb.edu. Any kind of final comment?
No.
All right. Well, I've really enjoyed having you. And folks, this brings us to the end of this episode of RT Matters. And we thank our guest, Dr. Brian Walsh, and you, our listeners, for tuning in. Remember now, we want to hear from you, our listeners, about what you like, what we can do better to make RT Matters work for you. We are the voice of the respiratory care community. You can always let us know what you think by feedback@rtmatters.com. And if you want any additional information about what was discussed in this or any other episode, go ahead and contact me. Now, in the meantime, go out and be the best possible respiratory therapist you can be, because our patients deserve nothing less. And as a highly skilled, licensed healthcare professional, we expect nothing less from you, our colleagues. So until next time, be kind to yourself and to others. And remember, RTs do indeed matter. So take care, be safe, and we look forward to having you back here real soon.